A lot of swimmers, we find they'll sit quite high on the Baton scale for generalised joint laxity, but we may have some that truly are hypermobile or have a connective tissue disorder. The reason that's important in the context of subscapularis tendinopathy is historically it's just been seen, we just do a lot of internal rotation strength, and whilst that might be reasonable, we might not be actually accounting for the secondary function of the subscapularis, which is to provide that anterior buttress of the head of humerus in the socket. So how we might assess that in a swimmer, if I get Zahn to have a seat here, I'll go through our typical test battery around our stability tests. So I'll just drop this bed down for you, Zahn, here. So what we're going to do here is, first test I'm going to have a look at for Zahn, if you're nice and comfortable there, is having a look at a sulcus test sign. So that's where we just grip and we feel the displacement of the humerus secondary to the acromion. And we can see here that Zahn's actually got quite a bit of a laxity. And then I will follow that up with a little bit of a load and shift. So I just mark out where I'm seeing my AC joint, having a bit of an appreciation of where his head of humerus is centered relative to that, and I'll just have a feel for the translation. And Zahn's got some good movement there. When you're doing these tests, just be really careful, because you notice that my fingers are right over his biceps tendon, and a lot of athletes will report pain in that area. So it's important we keep our hands soft. Sometimes people think about it like squeezing a lemon, because if you're digging in quite hard with your fingers, it'll be quite uncomfortable for the athlete. From there, one thing I find really useful, I'm going to get Zahn to have a lay down on his back for me. Head on the pillow, please. Is I actually do my anterior apprehension test as well. The reason I do this is because if we are getting some translation up into those overhead positions, sometimes the relocation component of the test actually resolves the athlete's symptoms. So when we're doing this, I'm actually going to get Zahn to come over nice and close to the edge of the bed here. And so, same way we do our apprehension relocation test, I'm actually going to stabilise. I'm always making sure I can feel. And I'm going to just rotate Zahn back here, and I'm just feeling what his head of humerus is doing under my hands. Now, let's say he goes, I feel my symptoms here. I'm feeling that there hasn't been much change in the head of humeral position here for Zahn. But some of our swimmers that have had pathology, what we'll actually find is we'll feel a forward translation. And what I might do there is just say, just push into my thumb there. So just like you're pulling your hand towards me, just pressing in there. And let's say that's painful for the athlete. Then what I would do is I would just actually apply a little bit of a posterior glide of the humerus there, making sure I stay at the same range. And Zahn's excellent, he knows what's coming. I'm just going to get him to push back in again. And we can use that as a little bit of a treatment direction test, have a relax there, looking at, does that change his pain and symptoms? And for a lot of the athletes that do get a lot of translation, providing that little bit of passive support actually makes them feel either stronger and or less pain, or a combination of those two. So that's a little clinical trick that I like to use because it helps me make decisions about making sure that if I've got an athlete that has got some translation, particularly when we're loading, what I want to do is make sure that I account for that as part of their rehabilitation. I can't just give an athlete that the head of humerus is moving around in its socket, I can't just give them lots of repetitive rotation internally. We need to give some control back to that athlete so that they can provide that stability so that then they can use their force that they've got in their rotator cuff, particularly around that subscapularis or that internal rotation direction.